Again, we're watching Curbside Consult. I'm having a great conversation with Michael Hiltzik of the LA Times. So now let's get to those Obamacare horror stories. So tell me about some of the stories that you've covered that where there was where there's some national attention, and then you dug a little deeper, and it turned out to be a little different.
Right. Well, I think the one that I probably did the most work on was a woman named Deborah Cavallaro, who was a real estate agent here in Southern California, who I noticed was getting a lot of airplay. She was on our local NBC station. She was on NBC nationally. She showed up on CNBC. She showed up on Fox. She was on Marketplace, the radio report. I later learned, although I didn't learn this until much later, she had actually been quoted in the LA Times before I was aware of her. She was telling a story about how the Affordable Care Act was not affordable for her. She said she had gotten a cancellation notice and had discovered that she couldn't replace her insurance except by paying 65% more in premiums. And she also said, she kept repeating that she was going to lose access to her doctors. And I was interested in this because it just sounded, when I would see her speak, that she wasn't actually telling a full story. She wasn't talking about what her benefits were under her old plan, what her benefits might be under her new plan, where she found the new plan, and so on. So I called her, and I reached her actually an hour or two after she had appeared on CNBC, where she was interviewed. We could call it an interview, but it was really just sort of a speech she gave with Maria Bartiromo, where she told this story. And when I talked to her, I had Covered California, which is our state enrollment website, up and running. And we just walked through her vital statistics and her situation, how old she was. Well, she's 60, she's single, she's looking for single coverage, what she had, what her old plan was, how much she was paying, what the benefits were, and what she was looking at moving ahead. And what I discovered very quickly was, first of all, she had not been on Covered California up to that point. She had gotten a cancellation notice. She called an insurance broker who told her, well, here's a plan you might be able to buy. She had I believe she'd been steered into a plan by her old insurer, which was, we've seen this over and over again, overpriced, under-benefited. It was basically just a way to keep her with the same insurer. And then when we actually plugged in all these numbers and looked at the benefits, we discovered that she was eligible for a much better plan. Even a bronze plan in California would be better than what she had. And she was eligible for premium subsidies, which, of course, she hadn't talked about up to that point. And then, in fact, she was going to do much better. She wasn't facing a 65% premium increase. She was facing a cut. She was going to have her old plan covered a part of her doctor visits twice a year at most. After that, she was going to be on her own. Hospital benefits were virtually non-existent. All the things that we've seen are flaws in these stories, that a lot of these stories were being told.
Now, what's happened to her story once you got to the bottom of it? I mean, she'd been all over the media. How did the media organizations and how did she herself respond when you dug deeper and determined with her that she actually was eligible for better insurance at a lower premium under the Affordable Care Act?
Well, I think she's sort of fallen off the media radar. Now, that might have been because she had been fairly fully exposed. She'd been pretty much everywhere already. She hasn't really expressed a lot of gratitude for my introducing her to Covered California. She went on a right-wing radio program a day or two later, in which she complained that she hadn't gone on Covered California because she was afraid that it could be hacked, that she was afraid of her personal information security. And of course, that's not an issue that's really been raised with the California website. And whether it's a genuine problem with the federal website. I think we're not quite sure. Um, and she kept insisting that the problem she had was that she was not going to be able to keep her doctors in her hospital. And I think I acknowledged in the original piece I wrote that that's a fair enough issue, and a lot of insureds are discovering that they're going to end up in narrower networks. But the fact of the matter is that she actually had not checked. She didn't know what her new network might be under her new plan because she hadn't looked into it. So she was spinning a yarn that was at best incomplete and at worst very misleading.
Now, did the news organizations that had interviewed her do any kind of correction or follow up?
Not that I'm aware of. In fact, CJR or The Atlantic or somebody went back and revisited her story and the coverage that she had gotten. And I know they asked Marketplace, how do you respond to the fact that you just put this woman on the air without actually doing the reporting? And they were quite defensive about it. They said, well, she was somebody who was expressing anger, and we put her on the air, as a representative of the crew of the category of American who's expressing anger, and I don't think that's good enough, frankly. I mean, if you're going to do that, you really have to do the reporting to determine whether they have a right to be angry and whether their indignation has any factual basis, and if not, you should say that.
I think many people's anger. I mean, there's a lot going on in these stories, and some people are definitely, will be facing less favorable insurance, in a variety of ways. There are both winners and losers. We think the winners will outnumber the losers, but we'll see on that. It does seem to me that there's two things there. One is change makes people angry and uncertain. And there's a lot of change here for people in her situation, and that's what's generating a lot of the anger. But the second thing is that, you said that reporters need to become experts to cover. This is not really a situation where you need to be such an expert. What you really need to do is you need to have the person's old insurance policy, and you need to go on to Covered California and see what she's eligible for.
Right. I should say I've been in situations where reporting has really been hard. I mean, I've been in situations where people have been actively trying to keep me from learning what I wanted to learn. I've been shot at, for example. I don't brag about it, but that's the fact.
Healthcare.gov is a dangerous site. I can see how that could happen.
That's right. This is not a case where the reporting necessarily is difficult or particularly challenging. You need to know the fundamentals of the law, and you need to know what questions to ask. And they are, if you're doing this professionally, they're pretty obvious. You want to know how old the subject is, the income, or at least whether he or she will be eligible for premium subsidies and copay and cost-sharing subsidies. You need to know the basics of the old benefits and the new benefits. What did they have for hospitalization, prescription coverage, doctor visits? How much did they pay? Were there limitations on the number of visits or conditions under which they pay? Mental health coverage, all these things, preventive care, and then compare it to what is available for the plan that they are looking at or that they're eligible for under the Affordable Care Act. And I think you also have to be aware, too, which is something that a couple of things that never get discussed that drive me crazy. One is that in all of these cases where we're talking to people who've gotten cancellation notices, we're always comparing their 2013 premiums and costs to their 2014 premiums and costs that they're finding under Obamacare. So one other thing you need to ask is, what's been your premium history thus far? How often have your costs been raised by your old insurer? And we know that maybe it's not an average, but in the individual insurance market, Costs have been going up by 10, 20% a year sometimes, certainly at least 4 or 5% a year. So you have to factor that out when you're talking about, well, what are they facing in 2014? Because they were going to almost certainly face higher costs going forward. The other thing that never gets mentioned is the real fundamental issue here in the individual market that the Affordable Care Act brings to the table is that many of these people, whether they're being canceled because they had non-complying coverage or because their insurer wanted to get out of the individual market, which happens a lot and has happened to a lot of these people, without Obamacare, many of them would be uninsurable. They would have come under the exclusions for pre-existing conditions. They would be medically underwritten in every way possible. And as we know, that's not allowed anymore. So right there, we know that a lot of these people who think they're victims are really beneficiaries. And that goes to one of the other cases I looked at. This is another exemplary case. Edie Sunby is a businesswoman in San Diego, who's actually a figure that really deserves our respect and admiration. She's been a 7-year survivor of stage 4 gallbladder cancer, and she survived in large measure, and she attributes her survival to the work of her doctors at Stanford and at the Anderson Cancer in Houston and at UC San Diego, which of course has a very fine cancer treatment program. But it's clear that she's also survived because she's taken her care in hand. She's made sure that physically and mentally she's kept fit. She has the support of her husband. So she's really done very well by herself. But she had a piece in the Wall Street Journal, an op-ed that she wrote, in which she said, because of Obamacare, I'm going to lose access to my doctors and I might die as a result of this. Because I've been canceled by my insurer and I've got to go find new insurers, and the only choices for me in San Diego are a network that will keep me having access to UC San Diego, but won't allow me free access to Stanford or Anderson. Now, I tried to reach her and never was able to get her to respond, but I did look at much more closely at her situation. And what was happening there was that she had an insurer, an individual insurance policy. The insurer informed her last January that it was pulling out entirely of the California individual insurance market. Now, this was an insurer that was pulling out of the California market not really because of Obamacare, but because it couldn't compete in the individual market. It had 8,000 customers in all of California. So it wanted out in any way it could find. And under California law, if you pull out of the market entirely, you're not bound to continue offering your customers continuing coverage. So she was going to be, as of really December, she was going to be cut loose. The point that I thought was important that she didn't make, but that needed to be made, is that absent the Affordable Care Act, here's a 7-year survivor of stage 4 gallbladder cancer. She's uninsurable. There isn't an insurance company in the land that would offer her a policy that any, even an upper class, middle class patient could possibly afford. So we need to keep all this in perspective, that these are features of the Affordable Care Act that we keep forgetting about, and that when we're reporting on it, we need to remember.
A couple of points on that, by the way. One is, you're right that without the Affordable Care Act, she would have been uninsurable. Under some of the alternative proposals to ACA, there would be high-risk pools to take care, or catastrophic coverage to take care of people with her set of challenges. Those also have questions about, what is the network of providers, what do you have to do to get into those? Do you need a period of uninsurance or of medical debt to get into those high-risk pools? How do they work? And there is the Affordable Care Act works much worse than my preferred hypothetical alternative that I haven't specified. And there's no doubt about that. So in these stories, there's that in the background of, compared to what?